If you're over 60, there's a 60% chance you're not getting enough vitamin D, and the signs might surprise you. Today we're covering 7 warning signs of vitamin D deficiency that you should discuss with your doctor. Stay until the end, because number 7 affects your brain health. Before we begin, an important note. This video is for educational purposes only and is not intended as medical advice. The information presented is based on current research, but always consult with your healthcare provider before making any changes to your health routine, especially if you have existing medical conditions or take medications. Vitamin D is often called the sunshine vitamin because our bodies produce it when our skin is exposed to sunlight. However, as we age, our skin becomes less efficient at producing vitamin D. According to the National Institutes of Health, adults over 60 need 800 to 1,000 IU of vitamin D daily, yet many don't get enough through sun exposure or diet alone. Let's look at 7 science-backed signs that might indicate low vitamin D levels. If you recognize several of these, it's worth talking to your doctor about getting your levels tested. Warning sign. Number 1. You're getting sick more often than usual. Research published in the Journal of Investigative Medicine found that vitamin D plays a crucial role in supporting immune function. A 2017 study involving over 11,000 participants showed that vitamin D supplementation was associated with reduced risk of respiratory infections, particularly in those who were deficient. If you notice you're catching colds or other infections more frequently, especially during winter months when vitamin D production naturally decreases, this could be a sign to have your levels checked. Warning sign number 2. You feel tired all the time, even after getting enough sleep. According to research from the Cleveland Clinic, vitamin D deficiency has been linked to excessive fatigue. A study published in the North American Journal of Medical Sciences found that vitamin D levels below 20 nanograms per milliliter were associated with significant fatigue in otherwise healthy individuals. One case study even documented a woman whose chronic fatigue and headaches completely resolved after her vitamin D levels were corrected from 5.9 to the normal range. While fatigue has many possible causes, if you're experiencing persistent tiredness, vitamin D status is worth investigating with your healthcare provider. Warning sign number 3. You experience bone pain or lower back pain. The Mayo Clinic reports that vitamin D is essential for calcium absorption and bone health. Research has shown a strong association between vitamin D deficiency and chronic pain, particularly in the bones and lower back. A study of 9,000 women published in the Journal of the American Geriatric Society found that those with lower vitamin D levels reported significantly more back pain compared to those with adequate levels. If you experience persistent bone or back discomfort, especially if it worsens during winter months, mention this to your doctor along with your vitamin D concerns. Warning sign number 4. You're experiencing low mood or feelings of depression. According to research published in the British Journal of Psychiatry, there is a significant relationship between vitamin D deficiency and depression, particularly in older adults. Vitamin D receptors are found throughout the brain, and the vitamin appears to play a role in mood regulation. A meta-analysis of multiple studies found that people with depression had lower vitamin D levels compared to those without depression. While vitamin D supplementation isn't a cure for clinical depression, the research suggests adequate levels may support mental health. If you're experiencing mood changes, this is something to discuss with your mental health provider. Warning sign number 5. Cuts and wounds are healing more slowly than usual. Research suggests vitamin D plays an important role in wound healing and fighting infection. A study in the Journal of Dental Research found that vitamin D deficiency was associated with impaired wound healing after dental surgery. If you notice that minor cuts, bruises, or surgical wounds are taking longer than expected to heal, this could be worth mentioning to your healthcare provider when discussing your overall vitamin D status. Warning sign number 6. You're experiencing muscle weakness or difficulty with balance. The National Institutes of Health reports that vitamin D deficiency has been linked to muscle weakness, particularly in older adults. This can increase the risk of falls, which is a major concern for seniors. A systematic review published in the Journal of the American Geriatric Society found that vitamin D supplementation, particularly at higher doses, was associated with a reduced risk of falls in older adults. If you're noticing increased weakness or balance issues, your doctor may want to check your vitamin D levels as part of a comprehensive assessment. Warning sign number 7. You're noticing memory problems or brain fog. Research published in the journal Neurology suggests a link between low vitamin D levels and cognitive decline in older adults. A study following participants over several years found that those with severe vitamin D deficiency had more than twice the risk of developing cognitive impairment. While vitamin D isn't a cure for dementia or cognitive decline, maintaining adequate levels appears to be important for brain health as we age. If you're experiencing memory issues or mental fog, vitamin D is one of many factors your doctor should evaluate. So what should you do if you recognize several of these signs? First, talk to your healthcare provider about getting a simple blood test called a 25-hydroxy-vitamin D test. According to the NIH, optimal levels are generally considered to be between 30 and 50 nanograms per milliliter, though your doctor will interpret results based on your individual health. Natural sources of vitamin D include sunlight exposure, 10 to 30 minutes several times per week, though this varies based on skin tone, location, and season. Fatty fish like salmon, mackerel, and sardines. Fortified foods like milk, orange juice, and cereals. Egg yolks. Mushrooms exposed to UV light. For many older adults, food sources and sun exposure aren't enough to maintain optimal levels, which is why your doctor might recommend supplementation. The typical supplemental dose ranges from 1,000 to 4,000 IU daily, but only your healthcare provider can determine the right amount for you, especially since vitamin D can interact with certain medications. Remember, these signs can have many causes, and vitamin D deficiency is just one possibility. That's why it's essential to work with your healthcare provider for proper testing and diagnosis. If you found this information helpful, please give this video a thumbs up and subscribe to Stronger Years for more research-based health information for active adults. Let me know in the comments. Have you had your vitamin D levels checked recently? Thanks for watching, and here's to your stronger years ahead.